Yeah, guys, are able to see my screen, right?
Yes.
Okay. Next route operation note down bypass. Bypass. Bypass means alter the diameter or root of a tubular body part. Alter the diameter or root of a tubular body part. Here, they will change the route of passage, either fluids, solids, or liquids, or gases. So when they will perform the bypass, na, any occlusion or atherosclerosis or tube was completely blocked, they will change the route. Or if they remove the particular area, they will change the route of passage, like ostomies, colostomy creations, or tracheostomy. For ostomy creation also they will do the bypass. Changing the route of passages should be considered as bypass. So here check, while they are performing the bypass, sometimes they will use the device, sometimes they don't use any device. May include use of living tissue, non-living biological material or synthetic material, which does not take place the body part. Includes one or more anastomosis with or without the use of device. This anastomosis was included in the bypass procedure. Whenever they performed bypass, if you seen the anastomosis word, anastomosis was not a separate procedure, remember. Anastomosis was not a separate procedure. Anastomosis was included in the bypass. Anastomosis means
Joining of that colon test.
end-to-end attachment, okay? End-to-end attachment considered as anastomosis. So, end-to-end anastomosis was, end-to-end attachment was anastomosis. Clear? So next, how to code the bypass? You will get the procedure like ostomies or bypass graft, CABG, coronary artery bypass graft, or colostomy, sigmoid colostomy, or tracheostomy creations. You will get for in the bypass route operation. Like this. See? Here they done ileostomy. Like because the patient had 20 years of history of severe complicated ulcerative colitis, he was admitted for surgical intervention. A total abdominal colectomy with ileostomy was performed, which means colectomy means
Whole of large intestine.
removal of large intestine. After removal the large intestine, they are attaching ileostomy. Ileum directly they are attached it. Ostomy was performed. So here ectomy and ostomy, two procedures. Same here. 3 months after surgery, the patient was again admitted for percutaneous endoscopic endorectal pull through with the excision of submucous portion of the rectum with endoscopic formation of loop ileostomy via existing ileostomy. This procedure was further treatment for the long-standing intraocular ulcerative colitis. Here also they done excision and ostomy. Ostomy should be considered as bypass. Remember. Here also ileostomy. Closer. They are closing the ileostomy actually here. See here also. The patient had history of frequent episode of severe chronic intestinal cystitis despite previous treatment. She has had no resolution of her symptoms. She was admitted for received an open partial cystectomy. They are removing the partial cystectomy, which means excision or resection.
Excision.
Cystectomy, excision or resection.
Excision.
And bilateral ileoureterostomy. After removing the cystectomy, after doing the partial cystectomy, they are doing bilateral ileoureterostomy bypass. So here remember, one case study you will get from the bypass, guys. Sorry, two case studies you will get from the bypass. Patient coming with rectal cancer. Physician performed resection of rectum. Sigmoid. Lead the course. After leading this case question, done. After leading, please inform me, okay?
Sir, 0DTP 7ZZ
0 DTP
7
Open approach. We need to take default open.
సార్ ఏదన్నా స్కోపీ అలాంటిది ఇస్తేనే ఆర్టిఫిషియల్ ఓపెనింగ్ అలా
Scopy లేదా they are inserted in the natural route. Then only 7.
Okay.
If they mentioned Scopy, you will get 4 or 8. Okay? 4 or 8. If they insert in the natural routes and done the procedure, 7. If they puncture needle or catheter or a guided wire, incision, 3 percutaneous.
ఒకసారి రిపీట్ చేయరా?
Then by అర్థం కాలండి.
యా ఒకసారి రిపీట్ చేయలే వినిపించలేదు వాయిస్.
Already I explained in the approach table. You can watch that video or read the approach table. You will get any scopies depends on the scopy. You will get 4 or 8 percutaneous endoscopy via natural or artificial opening endoscopy. We have different scopies. Then if they insert any instrument through natural route, 7 percutaneous, puncture or minor incision or catheter or needle. If they not mention anything, it should be open. Then lead the sigmoid colostomy creation. D1 sigmoid colon. What is the approach? Value sigmoid colon. N.
N, yes, sir.
Cutaneous value
4.
0 D1 N0 Z4. Clear?
No.
Next procedure CAB.
Last one, how, sir, we did? Last one, 0 D1 and 0 Z4, how to do it?
Under bypass colon sigmoid. Sigmoid colostomy bypass right root operation. Now only I saw lot of example na ostomy, ciliostomy and all. Tracheostomy. Under bypass colon sigmoid. Next root operation CABG. CABG means coronary artery bypass graft. Coronary artery bypass graft. So while we are coding the CABG, coronary artery bypass graft, the root operation should be bypass. Under bypass artery, then coronary. After check how many coronary arteries they are bypassing. 1 artery, 2 artery, 3 artery, 4 or more. If they not mentioned any artery, default 1 artery. If they given 2 arteries, we need to go with 2 artery. If they given 3 arteries, we need to go with 3 artery. Clear how many arteries they are bypassing. Based on that, you will get the code.
Sorry, ఏం నడిచించకపోతే 1 తీసుకోవాలా?
Simple గా they mentioned simply only coronary artery bypass graft. Then it should be 1 artery. Suppose they mention the artery names. We have the different names of coronary arteries: right coronary artery, left the ascending coronary artery, descending coronary artery, marginal coronary artery. Lot of coronary arteries. We have circumflex coronary artery. Okay, how many arteries they are mentioning, we need to check. They don't give, I done the perform of 3 coronary artery like that. They will give the coronary artery names. Clear? They will give the coronary artery names. Then under bypass, graft. Sir, under bypass, how many arteries they are performed, you need to check. Then you need to check the approach device qualifier. While they are performing the CABG, you will get qualifier from where they are bypassing, from where they are bypassing. You will get in the 7th character. From where they are bypassing the artery. It should be important. They are bypassed from the aorta, internal mammary artery, thoracic abdominal artery, thoracic artery. Different of artery or vein they will use to bypass the coronary artery to change the route. Coronary artery, where it will be located in our body? Heart, okay? In heart, coronary artery was located. So everyone go for the coronary bypass artery coronary.
Yeah, వెళ్ళాం సార్.
So you found number of
Yes.
arteries right here.
Yeah.
Remember
Yeah, one
up to
artery,
here.
4 or more arteries, 1 arteries, 3 arteries, 2 arteries.
Now we are going to 0 to 1 page.
0 to 1.
You can go for the 0 to 1 table. Everybody able to watch this page, right? Check here. In the body part, you are getting how many arteries? Then open percutaneous you will get. Then devices. If they not place any device, we need to go with no device. If they place the device, we need to select the particular device. What device they are placing? Then from where they are bypassing, we need to check. Suppose here, when we need to take zooplastic tissue device?
Animal.
When are they taken from the device from animal? Zooplastic. Autologous venous or autologous arterial means. Autologous venous or autologous arterial means they taking the graft from the same they take the species from the same person and they will harvest. Okay, grafting harvest taken from the same person. It should be autologous arterial or venous. Whenever they taken the same person vein for the grafting, autologous venous. Whenever they taken from the artery, autologous arterial. Synthetic substitute. Okay, lab grown developed. Then non-autologous. Non-autologous means from other person or other sources like banks and all. Okay, other person or banks, they are collected the device graft. It should be considered as non-autologous. Then from where they are bypassing, we need to check here. Suppose two coronary arteries bypassed from the aorta by using the autologous venous tissue substitute. What is the code? Two coronary arteries bypassed from the aorta using non-autologous tissue substitute.
0211 KW.
0 to 1.
02110 KW.
Keva. Autologous venous, right? I said.
9, sir.
9. Non-autologous.
Nine.
Non-autologous.
No, I said autologous venous tissue substitute.
9.
9W.
9 AA. Three coronary arteries bypassed.
0, 2, 1, 2.
0, 2, 1, 2.
0, 2, 1, 2.
0, 9W. Remaining should be same, just I change the artery.
09W.
Next check. So this is the important concept, guys. Now onwards, do not confuse in the CABGs. So whenever they done the autologous venous or autologous arterial artery, which means they are taking the sample from the same person, right? They are
Yes.
collecting the feces from the same person. They're removing the portion of body part. What code we need to code for that? Collecting the sample. Excision procedure we need to code now. One more procedure we will get to collect the sample. They are taking the portion of body part, right, from the same person.
Yes, sir.
For that we need to code excision. Okay, for that you need to code excision. From where they are collecting the sample, you need to go with the particular location under excision. That location you need to code. And whenever they are performing the CABG, they will initiate cardiac output. Which means cardiopulmonary bypass. This should be defaultly they will initiate it. Cardiopulmonary bypass. For this also we have code under bypass cardiopulmonary. Under bypass cardiopulmonary. Before starting the C series, in index itself you will get. Tell me the code. Before starting the C series you will get.
SA1221Z.
I it should be not yes.
Oh,
IA 1, 2, 2.
5A. Yes, sorry.
Yet.
సార్ ఇక్కడ bypass లో పలమనరీలో చూడాలా సార్?
Under bypass cardiopulmonary directly will get before starting the C series. Under bypass last code that in the B series. Under the B series in index last code. Bypass cardiopulmonary directly will get. Clear? Next. Note down this question, guys. Reverse right greater saphenous vein graft were brought from here to here. This question you will get in exam. Reverse right greater saphenous vein graft were brought from the aorta to the aorta marginal and the left coronary artery and right coronary artery. Continuous cardiac output and intraoperative pacemaker were used during the procedure and discontinued afterward. So this cardiac output should means cardiopulmonary bypass. So total how many arteries they are bypassing here?
2 at least.
3 కదండి.
3.
Aorta
3,
marginal,
2
left coronary, right coronary.
right.
3 arteries. Then what device they are using here?
Cardiopulmonary.
Right greater saphenous vein graft. So it should be what type of device?
Autologous venous tissue.
Autologous
Autologous.
venous tissue. From where they are bypassing? Graft where brought?
Aorta.
From aorta. So code the 3 coronary arteries bypassed from aorta using the autologous venous tissue substitute. 02120 Then excision of right greater saphenous vein. For this you need to code under excision vein saphenous right. Under excision
సార్ వన్ మోర్ టైం రిపీట్ చేయరా?
ఏదండి?
ఇప్పుడు 3 కరోనరీ ఆర్టరీస్ అన్నారు. లెఫ్ట్ కరోనరీ ఆర్టరీ, రైట్ కరోనరీ ఆర్టరీ, ఇంకొకటి
ఆప్టస్ మార్జినల్.
ఓకే.
Aptus marginal one. 3 arteries bypassed. From where? Aorta. What device they are placed? Saphenous vein. Saphenous vein means autologous venous tissue substitute. Autologous venous tissue substitute. Clear? Huh? Everybody able to lead these procedures, guys? Check under excision saphenous vein saphenous. At the ending, don't text me. I didn't listen the classes. I will join next batch. I didn't listen the classes. Can I read the paper? Can I pass? Everybody clear this case, question?
సార్ ఈ 2 కోడ్స్
Which codes, Andy?
06B
That only, no, only I am saying right under excision
NZZ.
vein
This is the
saphenous.
final last one. 0.
That already we
Under
discussed, right? Under bypass, cardiopulmonary directly will get.
ఎక్సిషన్ లోకి వెళ్ళి
Under excision vein
అండర్
saphenous.
బైపాస్ సెకండ్ వన్ సార్ 0
Under excision
vein
vein
saphenous.
saphenous. Right. Clear అండి?
Yes, sir.
Thank you guys. Next, these are the important root operations. Next, note down some questions related to other than the medical and surgical section. Okay, other than the medical and surgical section. Note down hemodialysis. So whenever they perform the hemodialysis, anybody have idea?
ESRD.
Kidney failure, right?
Kidney
Kidney
failure.
failures. Okay. Kidney failure. They will perform the hemodialysis, kidney related. Okay. Whenever the kidney function not functioning properly, it was unable to filtrate properly. Okay. Based on glomerular filtration rate. Okay. It was unable to filtrate the waste matter. So through blood. Okay. They will do hemodialysis because waste products was contaminated in the blood. So if the kidneys was not functioning properly, but they use the hemodialysis and they will filter all the blood. It was a hemodialysis procedure. So when the kidneys was not functioning properly, they will use. Here one question you will get, based on which lab test we can identify the CKD stages, chronic kidney stages.
Creatinine.
GFR value. Okay, GFR.
GFR value.
Based on the GFR value, we can able to identify the CKD stage. This question you will get in exam, guys. They will give like BNP, GFR, creatinine like that. So GFR value should be identify the CKD stages. Glomerular filtration rate. We have different type of CKD stages, right? CKD 1 to 5 and ESRD. Correct? Based on the GFR value, we can identify the CKD stage. Next, how to code the hemodialysis we can discuss. Diagnosis you will get mostly kidney related, kidney failures related. So everybody go to the hemodialysis in index.
Yes, sir.
What code you find? In index, what code you find? Tell me.
5A1B.
5A1D. Everybody find.
Yes, sir.
Now come to the table. After 0 series, you will get 5 series codes. Okay. Come to the 5A1 here. Go to the 5A1. D. 5A1. D. Fifth character we have duration. Sixth character only one option. Seventh character also one option. Based on the fifth character, we have total 3 codes. Intermittent less than 6 hours per day. Prolonged intermittent 6 to 18 hours per day. Continuous greater than 18 hours per day. These are the 3 codes for hemodialysis. 5A1D 70Z, 80Z, 90Z. So what are the things we need to identify while we are coding hemodialysis? Tell me anybody.
Time.
Time. Duration. Okay. How much time they are giving the dialysis. Then days. How many days they perform the dialysis. Suppose patient admitted in the inpatient hospital. Sometimes the patient was stayed 10 days, 5 days, 12 days, whatever it. So in the admission, how many days they perform the dialysis also important. Because each code beside you are seeing per day, right? Yes or no? You are seeing the per day value, correct?
Yes.
So this dialysis course was duration based and day wise based. Suppose patient was stayed in the hospital 2 days. Each day, day one they perform dialysis, day two they perform the dialysis. For day one we need to code and day two also we need to code. Okay. Suppose day one they done the 10 hours hemodialysis. What code you will get?
A 5A 1D 0H.
5A1D80Z, correct?
Yeah.
Day two also they performed 12 hours. Then how we need to code? Day one 10 hours, day two 12 hours.
Same.
Same.
Same code.
Same means
Same.
Same.
5A 1D 80.
80Z.
we need to code each day 5A1D80Z, 5A1D80Z. For each day we need to code. Day one we need to code. Day two also we need to code 5A1D80Z, comma 5A1D80Z. Suppose 3 days continuously 19 hours per day they performed. 3 days continuously 19 hours per day they performed.
5A 1D.
5A 1D 70Z.
19 hours.
90.
90.
How many times you will code?
3.
3 times. 3 days means each day we need to code 5A1D90Z, comma 5A1D90Z, comma 5A1D90Z. Clear?
We need to code same code 3 times, sir.
Yeah, exactly. Because day 1, day 2, day 3 we need to code.
Okay.
They are saying per day clearly now. Then we need to code for each day. There is no option. Okay. Same code we can repeat. Clear?
సార్ ఒక ఎగ్జాంపుల్ చెప్పారా?
ఇప్పుడు చెప్పేటన్ని ఎగ్జాంపుల్సే కదండి. ఇప్పటి వరకు మనం డిస్కస్ చేసినవన్నీ ఎగ్జాంపుల్సే కదా. డే 1 10 అవర్స్, డే 2 5 అవర్స్. లీడ్ ద కోడ్. డే 1 10 అవర్స్, డే 2 5 అవర్స్.
5A 1D 80Z and 5A 1D 70Z.
Day 3 days 20 hours per day. Continuously 3 days they done 20 hours per day.
3 times
5A1D90Z.
5A1D90Z, 5A1D90Z, 5A1D90Z. Correct? Same code repeat 3 times. If you code only one time, it for day 1. What about day 2 and day 3? So day 1 same codes, day 2 also same code, day 3 also same code. 3 times we need to code same code. You will get in exam same question. That's why I'm telling this many times. 3 days they will give the hemodialysis. First question you will get. Hemodialysis, 3 days of hemodialysis, 19 hours per day. They will give this question in exam. Like this, in one option they will give 3 codes side by side. We need to code that option. In one option they will give only 5A1D90Z. In another option 5A1D90Z, comma 5A1D90Z, comma 5A1D90Z. They will give this option we need to select.
సో ఇప్పుడు 4 days ఇస్తే 5A 1DZ ఎక్స్ట్రా యాడ్ చేయాలి అంతే కదా సార్?
5A1D90Z ఇంకోటి వస్తుంది.
ఓకే.
Depends on the duration. Suppose 4th day 10 hours ఇచ్చాడు, అప్పుడు 5A1D80Z వస్తుంది. Only 4 hours ఇచ్చాడు, 5A1D70Z వస్తుంది. How many hours they are giving, based on that we need to code each day. Clear?
Yes.
Thank you. If they not mentioned any duration, default less than 6 hours per day. Simply they documented hemodialysis was performed. They not mention the duration. Then less than 6 hours per day.
సార్ ఇప్పుడు 1 డే ఇచ్చారనుకో ఓన్లీ 5A 1D 70Z ఇచ్చేస్తే సరిపోతుంది కదా సార్?
సరిపోదండి. 1 డే ఇస్తే ఎన్ని అవర్స్ ఇచ్చాడో చూసుకోవాలి. ఇఫ్ ది నాట్ మెన్షన్డ్ అవర్స్ 70Z. అవర్స్ చెప్పినప్పుడు అవర్స్ బేస్ గా కోడ్ ఉన్నది కదా, 7 ఒక్కటి ఎందుకు ఇస్తాము? We need to check hours. How many hours they are giving each day. It was day 1 day, 2 day, 3 day, whatever days, leave it. If they not mention the hours, 7. Default. If they mention the hours, we need to go with hours. How many hours they are giving. ఎన్ని అవర్స్ చెప్పాడో అన్ని అవర్స్ ఇవ్వండి. అవర్స్ ఏం చెప్పకపోతే లెస్ దాన్ 6 అవర్స్ ఇవ్వండి. ఎన్ని డేస్ ఇచ్చాడు అనేది ఇంపార్టెంట్ కాదు, ఈచ్ డేకి కోడ్ చేయాలి. అర్థమైందా? Next question, lead. Mechanical ventilation. Mechanical ventilation. Lead directly in index mechanical ventilation.
Five A 19.
5A19. Go to the 5A19. In tabular list, go to 5A19. We have here 3, 4, 5, right?
Yes.
Yes, na? We have right 5A19. 3, 4, 5. Less than 24 hours, 24 to 96 hours, greater than 96 hours. Based on the hours, you will get the mechanical ventilation code. If they not mentioned hours, we need to consider less than 24 hours default. Suppose if they mentioned in the days, we need to convert into hours. Suppose they given 3 days of mechanical ventilation. What is the code you will get?
For 24 to 96 hours.
Code tell me.
945Z.
It was complete code.
5A194.
5A1945Z.
5A1945Z. Clear? If they not mentioned today, simply they documented mechanical ventilation performed.
5A19.
5A1935.
35Z. Clear? Check here how many hours they given.
Three days. So
3 days, right?
24 to 96 hours.
72 hours.
They given 3 days. So 24 to 96 hours between. Correct?
Yes.
This question you will get in exam, guys. Here I have how many hours?
48 hours.
48 hours.
More than 24 hours. 24 to 96.
24 to 96. Correct? This question you will get in exam. Endotracheal intubation and ventilation, both you will get. These two procedures in the single. Same piece of procedure. Respiratory distress syndrome. Same case scenario you will get in the exam. Patient coming with respiratory distress syndrome, and they will perform mechanical ventilation and endotracheal intubation. But in the exam point of view, you will get 5 days, 6 days of ventilation. What is the code?
5A1955Z.
5A1955Z. P39.8 should be PDX, and these are the procedures. Same case scenario you will get in exam. Instead of 48 hours, they will give 6 days. And endotracheal intubation. She was intubated on admission. This also you will get endotracheal intubation. What is the root operation?
via natural artificial opening.
Root operation. Approach via natural or artificial opening.
Insertion.
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 Insertion. Insertion. This case scenario also will get in exam. So now clear mechanical ventilation how to lead.
సార్ మళ్ళీ చెప్తారా?
సార్ ఒకసారి ఎక్స్ప్లెయిన్ చేయగలరా అర్థం క్వశ్చన్?
ఏం డౌటో చెప్పండి.
ఇన్సెషన్ అని ఎలా?
అది నిన్ననే చెప్పా కదండి, రూట్ ఆపరేషన్ ఇన్సర్షన్ అనేసి.
అదే సార్ క్వశ్చన్ లో ఫాస్ట్ గా చెప్పేసరికి అర్థం.
ఇంట్యుబేషన్, ఎండోట్రాకిల్ ఇంట్యుబేషన్ ఏ రూట్ ఆపరేషన్ వస్తుంది మనకి ప్రొసీజర్?
ఎస్ అంటే మేము స్లో ట్రాక్ కదా సార్, చిన్న క్వశ్చన్స్ అయితే అర్థం అవుతుంది ఈజీగా, కానీ ఇలా పెద్దగా వచ్చేసరికి కొంచెం కన్ఫ్యూజ్ అవుతుంది.
మనము కొత్త క్వశ్చన్ అయితే మీకు మళ్ళీ చెప్పినా నేను స్లోగా చెప్పచ్చు. నిన్న డిస్కస్ చేసిన క్వశ్చనే కదండి ఇది.
అదే సార్
ఎండోట్రాకిల్ ఇంట్యుబేషన్ నిన్ననే మనం లీడ్ చేసాం కదా. కొత్త క్వశ్చన్స్ అయితే మనం స్లోగా డిస్కస్ చేసేయచ్చు. చెప్పిన క్వశ్చన్ మళ్ళీ 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 స్లోగా మనకి ఎందుకు చెప్పండి. ఆల్రెడీ
మెకానికల్ వెంటిలేషన్ అంటే
చెప్పండి.
మెకానికల్ వెంటిలేషన్ అంటే ఎక్కడ చూడాలి సార్?
వెంటిలేటర్ ఇదండి.
ఇన్సర్షన్ లో వెంటిలేటర్ లో చూడాలా సార్?
వెంటిలేషన్ సపరేట్, ఇన్సర్షన్ సపరేట్ కదండి. ఇప్పుడే కదా లీడ్ చేశారు మెకానికల్ వెంటిలేషన్. ఎలా లీడ్ చేయాలో చూపించాను కదా. మెకానికల్ వెంటిలేషన్ అంటే డైరెక్ట్ మెకానికల్ వెంటిలేషన్ వెళ్తున్నారా? 5A19 లీడ్ చేశారా? Have you leaded 5A19 directly in the mechanical ventilation heading, right? Then why we need to go insertion? Insertion was the endotracheal intubation route operation. ఈ ఇంట్యుబేషన్ కి ఇన్సర్షన్ వెళ్ళాలి.
సో 5A1
పర్ఫార్మెన్స్ లో
లీడ్ చేయండి.
చెప్పేస్తే ఎట్లా అర్థమవుతుంది సార్ మాకు?
ఫస్ట్ లీడ్ ద మెకానికల్ వెంటిలేషన్. నేను లీడింగ్ చేపించే క్వశ్చన్ లోకి వెళ్తున్నా కదా. మీకు లీడింగ్ చేసేటప్పుడు ఏం సైలెంట్ ఉంటారు, క్వశ్చన్ చూపించినప్పుడు అర్థం అవ్వలేదు అంటారు. మీకు లీడింగే కదా ఫస్ట్ చూపించా. ఎవ్రీవన్ లీడ్ ద మెకానికల్ వెంటిలేషన్ అని చెప్పాను కదా. మెకానికల్ వెంటిలేషన్ లీడ్ ఎవ్రీవన్ ఫస్ట్. what you found in the mechanical ventilation in index?
సార్ 6 days అంటే గ్రేటర్ దెన్ 96 కన్సిటివ్ అవర్స్
అంతే
సార్.
కదండి. That's it. Greater than 96 only. 6 days means.
Yes, sir.
Lead everyone mechanical ventilation in index. What you find to tell me? In index, lead the
సార్ ఇప్పుడు
mechanical
వెంటిలేషన్ లోకి వెళ్ళి మెకానికల్ చూసి
direct mechanical ventilation you will get. That only I am saying. Direct mechanical ventilation, what you will get?
Performance respirator.
They given the code, right?
Yeah, 5A19.
That 5A19 find everyone.
Double 5 jet.
Yes, sir.
5A19 if you find, go to the tabular list for 5A19. If you go to the tabular list, you will get the durations. Less than 24 hours, 24 to 96 hours, greater than 96 hours. టేబుల్ ఓపెన్ చేశాక చెప్పండి.
యా ఓపెన్ చేసాను.
You find this watts, right?
యా
So here check how many hours they given the dial mechanical ventilation. Based on that, you will get the code.
వై
So if they mention less than 24 hours, you will get this code. 24 to 96 hours, 4. Greater than 96 hours, 5. If they not mentioned any hours, default less than 24 hours. If they given the days, we need to convert into hours. 3 days means 72 hours, 24 to 96 hours. If they given more than 96 hours, how many days itself? You will get 5. 5 days, 6 days, whatever it. Clear?
Yes, sir.
So you will get ventilator or ventilation words for the mechanical ventilation. Okay? Ventilator or ventilation you will get in the procedure note. Intubation was endotracheal intubation. It was different procedure. Mechanical ventilation was different procedure. So do one thing, daily open that class PDF I shared in the group, right? I shared in the group or not that class PDF?
Yes, sir.
So do daily practice yourself 10 questions. Clearly explanation also there. Then you will get idea. మీరు ప్రాక్టీస్ చేయకుండా ఏమీ రాదండి. ఓకేనా? You can go through that class PDF daily 10 questions you can practice. For your practice only I given that paper PDF for you. This PDF was clearly question, answer, explanation. You can practice yourself whenever you have time.
హలో సార్,
Yes.
ఈ పీడిఎఫ్ గ్రూప్ లో షేర్ చేయలేదు సార్.
చేశానండి. చేశాను చూడండి, క్లాస్ అని ఉంటుంది. So who are not finding, I will share again. Fast track lo I shared, slow track also I shared, I think. Again I shared. చేశానండి already. If you missed, I think. The PDF name was class. Previously itself I shared. On 5/19th I shared. May 19th I shared. చేయలేదని సింపుల్ గా అనకండి, చేశాను.
మాకు
Check
ఈ రోజే
చేయండి.
వచ్చింది సార్.
No, I shared 5/19th. I have history, right? I shared PCS PDF class and this PDF 1410 on 519.
Yes, sir. Sorry, చూసుకోండి.
అది మీరు చూసుకోకుండా చేయలేదంటే ఎలాగా? So, mechanical ventilation clear, right? Everyone?
Yes.
Yes, right.
Yes.
Thank you. So note down the exam related PCS procedures, what you will get in the exam. If you prepare these PCS procedures enough for the exam. Okay.
సార్ వాయిస్ బ్రేక్ అవుతా ఉంది సార్.
ఏం చెప్తలేదండి, క్వశ్చన్స్ నోట్ చేసుకోండి. ఎగ్జామ్ రిలేటెడ్ PCS procedure questions. If you prepare these PCS procedure questions enough for the exam. ఓకే, ఇవి నోట్ చేసుకొని ఇవి లీడ్ చేయడం ప్రాక్టీస్ చేస్తే చాలండి మీరు.
PDF లో ఉందా సార్?
No, exam related questions I am saying. Open the paper, right? Notepad.
Yes.
Note down all the questions. These are the exam related PCS case scenarios related questions. If you practice these procedures enough for the PCS, note down the first question onwards or take the snippet. Everybody able to lead these questions. That's it.
ఎగ్జామ్ పర్పస్ ఈ 3 సరిపోతుందా శివ గారు?
A3 అండి.
ఇప్పుడు మీరు నోట్ ప్యాడ్ లో పెట్టినవి
ఇంకా చాలా ఉన్నాయండి, డౌన్ చేస్తాను ఇవి కంప్లీట్ చేస్తే.
ఓకే అండి.
16 to 17 procedures we have. If you write, I will down the గ్రూప్ లో పెట్టడానికి అవ్వదండి అన్ని, మళ్ళీ నాకు రేపు పెట్టలేదంటారు. నోట్ చేసుకోండి, నాకు గుర్తుంటుంది, మీరు రాస్తే మీకు ఒకసారి క్లియర్గా ఉంటుంది. ప్లీజ్ నోట్ డౌన్ బికాస్ నా ఇఫ్ యూ write, you will read one time at least. If I share in the group, you will leave it. By next day, another material will come. If you are not read, you will get in the same video, you can watch and you can write it. Clear? ఇప్పుడు రాసుకోకపోతే గ్రూప్లో ఎలాగో వీడియో వస్తుంది కదా, ఆ వీడియోలో ఉంటాయి, నోట్ చేసుకోండి. నెక్స్ట్, రివర్స్ రైట్ greater saphenous vein onwards. 3 procedures for the CABG procedure. Then paracentesis was performed by using 18 gauge needle. C5, C6 cervical vertebral discectomy. C5, C6 cervical vertebral disc replacement. Right below knee amputation. Therapeutic IV medication through peripheral vein.
Sir, what was before this slide? Could you just go back once?
No problem. I will share the video now. You can note down anyway. Recording video I will share, right? Later you can watch and note down. Next, left kidney transplanted, already noted, no? More questions we have. 1 minute. These questions note down. Left knee arthroplasty and right hip arthroplasty. Left knee arthroplasty and right hip arthroplasty questions. Knee arthroplasty, right hip arthroplasty. These two questions also will get in the exam. Okay. These all you practiced the questions only, right? That's it mostly. This intubation and mechanical ventilation noted. Intubation and mechanical ventilation. This paracentesis noted, correct?
Yes.
Yes.
Noted.
Then these questions A, B, C, beta. This question note down. Mechanical ventilation 6 days. A19. 5Z.
9 double facet.
TT tube intubation, endotracheal tube intubation. Zero BH1 7EZ. Clear, right? If you prepare these questions enough for the PCS, guys. Okay. Go through the questions and I will share the paper, exam paper today or tomorrow by Sunday. Okay, take the print and start the paper preparation also. By Sunday, I will share the exam preparation paper in the group. By today, I will share the PCS mock exam. You can complete by Sunday whenever you have time. By Sunday night, you can complete. Okay.
సండే క్లాస్ ఉందా సార్ అయితే?
No. Sunday no class. You can do the exam by Sunday.